Hi, everyone. Welcome to chat. I think we're bringing more chairs. We have a bigger crowd than normal, so thank you everyone for coming. I know it's an important topic, and you can see who our guest speakers here are. Excuse me. Okay, so today's agenda, we'll be talking about physician services at White Sands, and that will be presented by Dr. Rowie and Dr. Given. Pat will present on life enrichment. Lorraine will discuss community projects. I will discuss dining services update and a potential team member flash sale. And then we will have question and answers after that. However, if you have questions for the doctors after their presentation, please ask at that time. So without further ado, I will turn it over to Dr. Rowie.
Thank you, Shelly. Okay. Hi, everybody. First of all, thank you so much for coming here. And hopefully Dr. Given and I didn't make everybody nervous by saying, we're going to be talking today. So I apologize. So nothing bad. We really want to welcome you all into a conversation that has been happening internally in our practice. And really the topic here is the sustainability of how we're delivering the services, the physician services here in the community and in our practice across the board. This is not going to be just a conversation here at White Sands, but for all of our members and patients in our communities. So again, really the conversation is some of the changes that we're experiencing in the healthcare field ourselves. And we're trying to figure out how do we adapt to that. And we don't want this to be a big surprise or a shock to everybody. And so we'd rather just bring everyone into the discussion to know what's going on ahead of time. And so that's why we're here. We have no intention of leaving or going anywhere, and hopefully you allow us to stay here. So I mean, from our standpoint, it goes without saying that we love you guys. We love White Sands. Dr. Given loves it here. For those of you who have met my wife, Salma, she loves you guys so much here as well. So our intent, again, is to continue delivering the care we can deliver. So again, Dr. Given is not leaving. We're not going anywhere. We're dedicated. Now, what we're trying to figure out is how do we sustain this current model of care and continuing to ensure the quality, the high touch, the time that we can afford to everybody with some of the constraints that are going on externally in the healthcare field. So currently, you guys know that Dr. Given is here, and Dr. Given is here 3 to 4 days a week, 9 to 2 in the clinic, in the wellness clinic, and then as well as covering the care center's needs. Oftentimes we're able to provide same day or next day appointments. And then those of you have had a chance to meet Helen, one of our nurse practitioners, who will cover from time to time if Dr. Given is out sick or if Dr. Given is away on vacation. Our goal is to continue providing comprehensive care, comprehensive geriatric care. We are geriatricians. We are not just primary care doctors. That's the way we see ourselves. And we're biased because we feel that comprehensive care for older adults is a lot different than traditional just primary care. And so we know that that takes time, and we want to spend that time with everybody. Doing chronic disease management, medication management, providing acute care needs. So with that, we're trying to figure out how do we continue being able to provide this as opposed to turning into a traditional primary care practice where we're seeing like 15, 20, 25 people a day, because then that cuts down everybody's time as well and the care and attention. These are our current limitations right now. So we have time constraints, insurance. So this is kind of the core of it, is that I don't think anyone realizes that since the time we started here at White Sands, we have now taken a 10% cut from reimbursement from insurance. And this is across the board again, not just here at White Sands, but all of our communities. And we're trying to figure out how do we survive this, right? And how do we survive continued cuts that keep coming down the pipeline? Because with the current administration as well, there's no signs that they're going to let up on this. And the concern is they're going to continue to cut programming and funding and resources. So within the sole insurance model, we have constraints that are limiting us in our long-term sustainability. What's great here is that Dr. Given is able to care for about 115 residents in the care center, in the community, sorry, not just the care center. But again, the typical doctor has a panel of close to 1,500 to 2,000 patients. And that's what insurance is pushing, is volume over the value of the care. And we don't believe in that. We don't want to go that way. We don't want to turn into that. So we are internally, we don't have the answers yet, but we're trying to figure this piece out. And we just want you all to be aware that we're working on this. The other issue too, of course, across the board in the community are the rising costs of running the practice. Employee costs are going up, our vendor costs are going up. So not only is reimbursement going down, but all our costs are rising. And so we have tried to slim down and streamline our operations in the office to minimize costs as much as possible. And now we're kind of like, how do we keep doing this? I'll let Dr. Given talk a little bit too.
Hey, everybody. Thanks for coming out today. Dr. Rowie and I, we have a problem, and that is that we practice a type of medicine that isn't valued in today's world. Our problem is that we don't know how to practice any other way. I have done the high throughput model. I can't do it. I'm not going back. And part of the reason why I joined with Dr. Rowie and Align Geriatrics, almost a few years ago now, is because he carried the same values that I did. And I'm incredibly grateful for him for not telling me, hey, Dr. Given, you got to pick it up a little bit. Because I wouldn't be able to stay around. I can't do it any other way. As Taib had mentioned before, or Dr. Rowie, excuse me, had mentioned before, most physicians are managing 1,500 to 2,500 patients. Somehow they see 20 patients a day or more and still sleep at night. I cannot. This clinic has afforded me the opportunity to practice medicine the way that I feel it needs to be practiced. And for that, I'm incredibly grateful. And I'm here because I love all of you guys, and I want to stay here, and I want to make this work. So that's where we are. Let's see. So what we're not getting into today, but what we're introducing you to is sort of where we are, and again, the thoughts and discussions that we've been having internally. And we want to figure out a way to continue to make this work. So we're figuring out ways, thoughts on that, maybe even introducing a dedicated 24/7 concierge service, which we can talk about. But again, that's where we are now.
Yeah, this is again today just an introduction into what we're thinking. We don't have the answers. We don't know that quite yet, but we know that we have to make some adjustments in order to continue to survive all these changes we're encountering. And as soon as we have these answers from our standpoint, we would love to sit down with everybody and have a dedicated meeting to go through what options we think we can provide and how we can continue to sustain providing the care, and what that may look like. So today is really just an introduction, again, just so you guys know where we're at, and know that we will have to make some changes. We just don't know exactly what that looks like at this moment. But most likely in the near future here, probably in the next upcoming weeks, we'll set up another meeting, maybe set aside like an hour where we can all walk through, some of the options we've come up with, and then answer any and every question that can be thought of. But we figured this way too, it'll present some time for you guys to think about this as well. Thank you. Yes.
Before you came, some people had a $20 copay.
Mhm.
Have you considered adding a copay? There used to be one, and I don't know why it isn't.
Why we stopped, yeah. So some practices will charge a copay up front, whereas we don't. We collect a copay on the back end. So we'll still provide the services. If you have a secondary supplemental insurance, it covers the copay, unless you have a deductible that still needs to be met. So we still collect a copay, but it's just after the fact, not upfront.
Doesn't seem to come from the patient.
Right, it's not coming from the patient. So
And in the past, it came from the patient, so that would be an additional source of revenue.
yeah. I mean, I think what happens is it gets reconciled with the insurance. So if you charge it ahead of time, then when it gets all billed out, and this goes to, the billing is so convoluted too in healthcare. So similarly, when you get your claim, your EOBs that come to you, and there's like a million numbers on there, and it's like, well, what really happened here? So that the same thing, I think what they do is reconcile that you had paid that secondary or that co-payment, and so that it doesn't go against your
So they
insurance, or
pay
you
you
get,
less.
yeah, then they pay us less.
Okay.
Yeah.
What is the advantage of having a geriatric doctor here versus one at Scripps? Because you say they handle more patients a day,
Yeah.
but I have no problem with the service I get from them, and they're
Yeah.
quick and they're easy.
Yeah.
And I just don't know what the advantage is one way or the other.
Yeah, it's a great question. I mean, it's a personal decision, right? It's here you have more immediate access to care than going to a clinic. And I think it also depends on the trajectory of where you are in your aging process, right? If you're a younger, healthier, more vibrant, and able to easily get out to these clinics, then it may not make that much of a difference. Now, we still run across, because a lot of those clinics actually reach out to us to help them out too. And so there's a lot of behind the scenes stuff that you guys don't see. And what happens is they may not have an opening, and because we're also trying to work with Scripps, UCSD, Sharp, with sometimes not here in this community, but with Kaiser and other locations. And so we're always trying to figure out how do we best accommodate. We know in general, our accessibility is a lot faster than getting into those clinics. Now, another big factor here, and we didn't touch upon this because I don't want to overcomplicate it, but the end of this month, so the last several years, because of COVID, the federal government has allowed for televisits and video visits and phone calls and all of this to happen. They keep extending that authorization, but it technically needs to be an act at the federal level to change this indefinitely. The end of this month, it's supposed to expire. So we're all still sitting, we're like trying to figure out, are they going to extend this again, or are they going to finally, put an end to it? Now, all these other clinic providers in the community that have been leveraging the telehealth, televisits and the phone calls won't be able to do so anymore because there's no reimbursement for that. So we're also trying to figure out what do we do if that happens as well. But in our practice in general, across all of our communities, we're more in person than video televisit.
Many of us, just because of our age, have given up driving. And so getting to those clinics sometimes is very difficult. And we rely on White Sands to drive us, but they can't always do that. So it's really helpful to us to have somebody here that we don't have to drive to get to.
Yeah, thank you. And we recognize that as well. And again, this is not just isolated to White Sands, across San Diego County.
Hi, I'm not clinically trained, but I've had 30 years in healthcare administration. It sounds to me like you guys are trying to run a concierge practice on current, Medicare reimbursement. What is two just quick questions so I understand going forward? Dr. Givens, what is your panel size for all the places where you practice, roughly?
He's
115 here. What would you guess?
I am only here.
Okay, so you're running a panel size of 115.
That's right.
Okay, all right. And do you guys also get reimbursement because of being medical directors for skilled nursing facilities and stuff like that?
Yeah, but if we do, yes, if we do
Right.
cover skilled nursing facilities, then that is for the administrative oversight of the skilled nursing.
No, I understand. And final question, how would you compare the overhead in your practice, Dr. Givens, to a typical geriatrician? On a per patient basis, et cetera? Is it higher? It seems like it might be lower. I'm just curious.
So we try to be lower.
Right.
Because we're mobile.
Right.
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 And now the other piece to that is that it takes a lot more care coordination on the back end.
Right. Sure.
So having the infrastructure, having the
Right.
people in place to actually allow all of our providers to be mobile across the county.
So it's more labor intensive as opposed to facility intensive. Is that correct?
Yes.
Okay.
That's
good.
correct.
Now, thank you for that. I'm just helped me to think about it.
Yeah, that's
Because I think you're trying to run a concierge practice on current Medicare reimbursement.
I
It's
think-
just, 3 and 2 don't go.
I think what's going to end up happening is, so in today's model, a lot of primary care practices are also looking at what's called direct primary care, but they opt out of insurance, they opt out of Medicare so that they can just go straight to the patient. Now, you can still provide insurance-based care and potentially have additional fees that are not covered by your insurance. So for us as a geriatrics practice, it would not be wise to opt out of Medicare when everybody utilizes Medicare. And what's happening too is that other services that you may need, like home health or other services that are taking Medicare, guidelines are changing such that the doctors that are ordering those services need to be part of Medicare. And so if we opt out, then we can't also, the fear is we can't coordinate all that with you guys, for you guys. And so, once you opt out, you're locked out for 2 years. So we can't say, oops, this didn't work. Okay, we'll go back and figure this out. So there's, we're looking at all of these aspects.
Oh, so you said that Medicare reimbursements have gone down 10%. I mean, that sounds to me like Medicare has been cut 10%. I mean, in the political world currently, that would be a horror statement.
Yeah.
Did that happen or how did
It's
that happen?
3.5% every year since we've started. And so another 3.5% this year as of January. That's what, so it's about, what is that? 10.5%. So that's why when this year, what happens is they keep saying, okay, we're gonna reduce reimbursement. Then all the parties that try to step in and say, don't cut reimbursement. All the lobbying efforts from clinical practices, physician lobbying efforts, but it hasn't. And they were hopeful they could overturn it of recent, but it hasn't happened. And so if this continues in this trend, that's why we're now thinking, we've got to think ahead. Like, if this continues, what's going to happen?
The other point of that, or something to add on to that, is back in 1998, the work value unit that Medicare uses to create their reimbursement structure, one work value unit was $36 and change. Had it increased with inflation since 1998, it would now be, I think it's 67 or 76 dollars. It's gone down to $32 and change. So doctors essentially in the last 22 years, 23 years are making about a third of what they would be if adjusted for inflation. And then on top of that, the recent Medicare cuts just, you know, pushes it further. And yeah, that's the state.
And please know that, like, we're not here trying to figure out how do we make money. It's honestly, how do we survive? Because right now I mean, truthfully, the fact that Dr. Given is here full time at this census, do you want me to be like
Sure.
open?
Yeah.
Like, so the truth is that he doesn't even generate half of what a new doctor coming out of training does in a salary working in the community. So it's just not sustainable. And we don't want to go back to being like every other doctor. So yes, it may have to become some blended model of like a concierge or like a blended cash and insurance model. We don't have that worked out quite yet.
Okay, I have a question over here. Right here.
Yeah.
Okay, my question is, when we subscribe to being here, pay our upfront fee, et cetera, it seemed to me at the time, you'll have to correct me, that there was going to be medical care here. And not that we wouldn't have to pay for it, but there was going to be medical care here.
Mhm.
So why isn't Human Good or White Sands or somebody able or should be paying the bottom line to keep you here? And I don't mean for every one of our visits, we still have insurance and all this kind of stuff, but to have hired you full time to fill that obligation that we have bought into.
I mean, that's a tough question, right? That's way beyond my.
I know, but I actually was asking Shelly.
Oh, okay.
Yeah, so we've never had the model where Human Good pays the physician to be here. Of course, if we were to go to that model, that would be passed to every single resident here if they use our services or not. So we want to avoid that and keep your costs low if possible. So yes, I appreciate you stating that that is part of, part of the sales spiel, that we have a physician here full-time, dedicated to White Sands, but it's never been incurred in your costs.
But shouldn't it be somehow, if that's what we all think we're gonna have when we come here, because we're old and we're gonna die?
So she's saying, shouldn't it be somehow, if that's what we all think we're going to be having once we move in here? Again, that would increase your costs. So we're trying our best to not increase costs. Yes. We're using the microphone because we do have a Zoom audience as well that probably can't hear without microphones.
So when we moved in 2005, there was no medical doctor here.
Ah,
We went to Dr. Lazarus' office down about a mile away. And finally, within about 2 years, 1 or 2 years, it's 1 or 2 years, it started.
so it sounds like we've had a physician here since about 2007. That was before my time. Shirley has a question. We'll give this about 5 more minutes, okay, doctors? Thank you, I appreciate it.
I just want to thank you for being so clear and open about a very, very difficult situation. My vote is that I love your model. I'll really support any way you can do to keep it. Thank you for providing it.
Thank you so much. Thank you. Thank you.
When you doctors went to medical school, you didn't think you'd have to take courses in insurance. And I'm sorry about that. We appreciate you. One time I told Dr. Givens, don't you leave. And accordingly, you're not. So thank you very much.
Thank you. Thank you.
Yes, someone was bringing up the question of medical care here. We moved here, it was from out of state. We didn't have a resident doctor. And we were asked if we would like to sign up with one of the physicians here as our private physician. And we chose to do that. We signed up as their private patient. Clinic services are something totally different. Because I know many people here probably take advantage of the clinic for medications and other things. They may have a private physician someplace else that they are paying directly. We go to Dr. Givens because happens to be my personal physician. It is not just because he is here at White Sands.
Well, thank you. Thank you. Oh, okay. Oh, sorry about that on the Zoom. Sorry.
That's it. It was just a comment.
Okay.
Stand in front of the camera.
Dr.
Yes.
Rowie, so pleased with Dr. Given. It's the best we've ever had here,
Thank you.
whether here or wherever we live. So how would the concierge service work? Would we bill Medicare ourselves? You would bill us?
Yeah, it would likely be similar to how Scripps and UCSD concierge currently works, where it's still insurance and then you have your monthly fee or annual fee. And again, really this model, I mean, it's fantastic that we have Dr. Given here for 5 days a week. And in our practice across the board, it's not like that in every one of our communities. We may only be there twice a week or once a week. And then for a lot of our residents that are in private homes all across the county. So we're really looking at this as a standardized approach in how we're approaching this across our entire practice. Again, it's not just here at White Sands, not just isolated to you guys, but we felt so strongly that this is such an important community for us that we want you guys to be a part of this discussion where, we haven't really had this discussion elsewhere. And so, yeah, we don't have the answers quite yet. But we'll see what comes about. Yeah.
One of the things that's happened over time has been for large companies to self-insure. Is that a possibility with Human Good? Shelly?
No. No. That's the short answer. So, although we think of Dr. Rowie and Dr. Given as family, and I know you all admire both doctors, I hear that nonstop. They are still a provider for the community. They're a vendor per se. They run their own business, just like our therapy company does, just like the psychiatrist, the psychologist, the audiologist, and the podiatrists do. So they're not paid directly by White Sands. They're not White Sands employees. They are a vendor that we partner with.
On the other hand, we have a clinic.
Yes, and the clinic is
and the funding for that comes from the residents.
Correct. That's the nursing staff that provides services to all of you. Some of them are on the back. They're listening to this conversation. So yes, the clinic is still available 24/7. We do have nurses available. We have med techs, we have CNAs. That's part of the community fee. Yes.
Okay, and my last question was that Dr. Given, you talked about our, I think you called the providers are costing more. What would be your provider for you here at White Sands?
I'm not sure I understand. So
well, I guess maybe it might be the outside blood draws and the mobile X-ray. But I wasn't sure what you meant by that.
Oh,
More from the practice, maybe.
right.
So, yeah, so maybe that's more on the practice side as a whole, because in addition to Dr. Given and myself, we have 6 other doctors, 2 nurse practitioners. And so in the community, the cost of doctors and nurse practitioners is going up across the board because of cost of living, because of San Diego is a really expensive place too. And so that's what I meant by that, sorry.
Okay, last question. Larry's looking at me, so I'll take the last
It's not a
question.
question. I just wanted to make a statement about the medical team that Jen runs. I think they are terrific. They are right on the ball. And they take care of everything for you.
Thank you. Oh, well, Deanna is the Health Services Administrator, so Venus is the Health Services Administrator. She's ultimately over all of healthcare. Then Deanna reports to her through the clinic, and Rolene reports to her from the health center. And then all the nurses are under Deanna or under Rolene. Okay, doctors, thank you so much for your time. I appreciate it. Thank you, thank you. Okay, who best to follow that but our very own Pat Guerrera?
Yes, my news is earth-shattering and it's gonna impact your life. No, I'm gonna talk about Cubigo. Yay, your resident or interest profile and the active everyday challenge. So something light after all that. So Louise, can you help me get into Cubigo? So last week I was very lucky because I went to a community life director retreat. And you can only imagine how much fun we have when you get a bunch of people that like to plan parties and do skits and do all kinds of fun things. It was a really great time in beautiful downtown Fresno, California. Yes, but I did learn a lot of things while I was there about just how to provide better programming and really to seek out what you are interested in. So you're actually looking at my Cubigo page. And one of the things that was brought up, and I made some little notes here, was what we had to do as activity directors is we had to go in and fill in our profiles, just like I've asked you all to do. And so I'm going to pull up my profile. Oh, but I didn't fill it in here. I filled it in on a dummy one, but I can still show you what to do. Connections, not connections, preferences. So I probably didn't fill in very much on here because I had to do it on another thing, like, yeah, hardly anything. But this is the place that we want to go. So when we were talking about it, they gave us a form that showed how many of our residents have actually filled in their profiles. So a little statistic for you, as of today, we have 257 residents at White Sands, and our daily average use for Cubigo is 55%, which breaks down to, if I am not a math person, my phone did the math, 141 residents. So I thought, great, 141 residents are using Cubigo on a daily basis. Do you know how many residents, I'm going to ask you to take a guess, how many residents have actually filled in their profile on Cubigo? Well, Ken King says 4, a little higher than that. Oh, Ursula said 0, Chuck Marsh said 17, 24 residents out of 141 users. That made me very sad, very sad. 24 residents No, not 24%. So, and the activity that we did was we filled in our profile, and then as community life directors, we had to plan a week worth of activities, noting what were the most important activities, what the most people wanted, making sure we had some for the people that were the outliers at the bottom that checked off just a few things, but just a balanced program. So I know that we all have a great time here, and I get comments all the time, suggestions all the time of all the things you want to do. And I think we pretty much meet that on a consistent basis, at least with the people that are vocal. But there's a lot of people that don't tell me what they want to do. And so I worry about that I'm missing all of those people. Now, whether those people are actually going to go into Cubigo and do their interest profile, I don't know. But so I'm just asking nicely, if you have time, all you do is go in and check boxes. Yes, I want to be in the choir. Yes, I love community discussions. And you just keep going and you do all of that. And then when I have to look at metrics, which I will be doing soon, then I'll be able to, I'm sorry, I wasn't speaking in the mic. Then I'll be able to see, wow, look at all the people that really want to have community discussions, which I think we have a lot of here. We have a lot of wonderful lectures and other presentations here. But then I want to make sure that all those people that maybe checked underwater basket weaving, somehow I can help them. We always tease that was a course at UCLA. I never took that course. Okay, so that is about Cubigo and the interest profile. Then one other thing I wanted to show you was, sorry, I can't hold the mic and scroll. I'm not very good at this. The last time I did this, I had a broken elbow. I didn't know that at the time. So in the news feed, you know, we post all these wonderful things. This is a wonderful discussion coming up highlighting women on Thursday, March 13th. They just posted it up, and that's from the Connections event team. But what I wanted to show you is a quick and easy way for you to record your active everyday challenge. So I put a quick hot link in there for you. So the active everyday challenge is still going strong. Our team members, we all discussed ideas of ways to get people involved. What was super fun at the conferences, we're having this meeting and it's very intense. We're learning about this new customer service model that's going to be rolled out to all the department heads. And all of a sudden, the woman who's in charge of the program grabbed the mic from another speaker and said, "You got to stop." And in flooded a flash mob of dancers, all about active every day. So active every day is a way that we're supposed to be trying to get a little more active, whether it's physically or cognitively. I know that you all attend lectures, you knit as Bev Grant's doing. These are all things that you can count, but you don't have to. I think you all got a little caught up in this, that it was more complicated than it is. So here on the news feed is the form. And if I click on this, and God willing, it's going to take me right there. It did. All you have to do is choose your community. And you'll choose White Sands. Wherever White Sands is. Well, okay, I won't go there. And then you have to put in a number. And I don't want you to overthink this. I don't want you to think, well, I did a half an hour of fitness this morning, and then I'm doing an hour of knitting here, and then maybe I read a book. Just kind of guesstimate for the day, the week, and put it in there. Yeah, I read a book. I think it was like 4 hours. I did a puzzle for 45 minutes, and you can round up. So I didn't say cheat, I just said round up. So then you want to put in a number. See, it doesn't ask for your name. It doesn't ask for a date. So it's super easy to do. And we're in 5th place right now, and we're more than halfway through the challenge. So Shelly wants us to win. I keep saying that. But yeah, it would just be great. But other than that, it's really just a way for us to think about, wow, today, instead of sitting at my desk, I stood at my desk and kind of marched around so that I was more active. I'm just trying to think more active physically and cognitively. So that's easy. I think that was all I was supposed to talk about, right? Doesn't that sound good?
Yes.
But yes, okay. Oh, did you want me to? I'll share Lorraine's stuff now. No, yes, Karen. Today or, well, the last couple of weeks. Go ahead.
Okay, are we putting in just for today or do we go?
So it doesn't matter. If you haven't put any in yet, then go ahead and kind of look. I looked at my calendar and go back until the start. The start was February 15th, the day after Valentine's Day. So, you know, just kind of guesstimate and think, yeah, I did this. I went to a play, I went to a concert. Those are all hours that you can count. But we want to, it's almost done. So we want to get those hours in. And if you haven't submitted any at all, go ahead and submit, and then you can submit again at the end of the month. I know it's another thing that you have to worry about, and it's not a serious thing. It's not at all serious like the doctors or anything. If you do it, great. If you don't, it's going to be okay. We'll live. Okay, thanks. Shelly thinks it's serious. She wants to.
Well, I'm Team White Sands, so yes, I will take it seriously if we can. Go White Sands, thank you. So that I have put in my numbers. Yes, I don't stand at my desk and march in place like Pat does, but maybe I'll have to start doing that. So Pat's takeaway is complete your interest profile. Remember, she asked nicely, and then complete your active everyday challenge numbers. Thank you. Up next is Lorraine Duran. Okay.
I think I would have rather followed the doctors. I think I would have rather followed the doctors. Pat's always exciting. And Pat, by the way, whoever checks out environmental service cleanup, can you let me know? I might want to hire them. So on your checkbox. All right, so good afternoon, everyone. I've got project updates for you. Let me put my glasses on so I can read what I've got here. And then please let me know if you have any questions along the way. Our landscape improvement project that on the corner of Olivetas, that's underway. I think you guys have probably seen, we started working there in the last couple days. So we expect that this project is going to take about 3 to 4 weeks based on current weather conditions. Might be a little bit quicker if the rain lets up. I know we were supposed to have our tree trimmers out here today and they stayed home due to the rain, even though we tried to tell them that the sun was out. Our video wall. So we're going to be replacing our current video wall and we are upgrading to an LED panel system. So similar to what all of you saw that we had rented for all of you during the Olympics. So I think you guys are going to really love it. We're also going to be replacing all of our microphones and our beach camera through our same vendor. And our beach camera is in need of being replaced. And so that will be included in that project. Walkway lights on Camino de las Palmas, those are in progress. Have you guys seen the new lights that we've been putting out? I hope you like them. Yes, they are very bright. Yes, 4,000 lumens. Our assisted living refresh project, we're expected to complete phase 1, which is the 3rd floor in the last week of March. Phase 2, which is 2nd floor, will begin the following week. Our resident laundry rooms, the new washer and dryers have started to arrive, and so we'll be replacing them floor by floor as they're delivered. We just got the new set for the 0 floor on the north wing, so those are going to be going in, I believe, tomorrow. Our cooling tower replacement is in progress. That supports all of our HVAC for the community. We expect that to be completed in May. Corridor carpet replacement, where we will be replacing 1 floor per year. Carpet will be replaced on the 2nd floor in the next 30 to 45 days. That carpet's already on order. Our swimming pool. I know you guys are always anxious to hear about the swimming pool. So we have submitted all of the requested information to the city. Once again, our contractor does anticipate that this will be the final round. We were very lucky in the last few weeks. We did hit a little bit of a snag with some information that they needed that potentially could have caused a long delay. And I was able to partner with our solar company, and they already had the information from when they put the solar panels in. And so that helped to expedite things. Our master plan, which is for the West Campus exterior areas. We have interviews that have been underway with architect firms. So far, I've done 3 interviews have been completed. 1 more will be completed next week. And we're waiting proposals that have been based on resident feedback that was provided. Once I get those, we'll be going over them with the Buildings and Grounds Committee. And our Ocean View Lounge refresh is currently under funding review. Once that's approved, we'll move forward with ordering our new furniture. Oh, wait, I don't want to steal that thunder yet. Questions, Chuck?
How much money are we saving with our solar panels? How much money are we saving with our solar panels?
So the question is, how much money are we saving with our solar panels? I'm going to turn that over to Shelly.
So while I don't have all the exact numbers, we've saved over $10,000 each of the last 4 months. Yeah.
Yes, Liz.
And this has been my complaint for several years. We need clearer directions at the corner to tell people where the main entrance is. I have sat outside assisted living and people will come, they don't read the sign on the door. They have come up, they are meeting relatives. It's the first time they're coming and they're trying to get in the assisted living door. The problem is the addresses are both the same. Are you going to improve the signing so the entrance will be clearer to people?
So I have had this comment from a lot of people.
I mean, even Uber is having a problem.
Yes, they do at
And
times.
Flores
I
and
have heard. It's over there. Let me answer her question first.
okay, as long as it goes along with my question, because I've been waiting to ask this question for a long time.
I've discovered that when you put 7450 Alavitas Avenue into your car GPS, your trip planner, whatever you use, your Apple car, it sends you to assisted living. That's a big, big problem for people who haven't been here before.
Okay, so I think all of you heard that. So when we put in the original sign, the monument sign on the corner, we did have them add main entrance and assisted living at the bottom of it. Now, I don't know how many people don't see that. It is there. So we are looking for ways that we can improve that.
Big letters. And then tell them somehow, if you want assisted living or memory, ask at the front desk and they'll direct you. I mean,
Wait.
For me, it's a big problem.
So the question is can't we just put a big sign, one sign that just says entrance this way, assisted living this way? So that is something that Shelly and I will talk with a CSC and see what we can do to change but we'd have to change the monument. So there is existing signage that does say that. And as Louise said, I have run into that also when I've been helping to direct people where their GPS did send them to assisted living. Yes. So, hold on.
Lorraine?
That number off?
Yeah.
So the question is, can we just take the number off 7450 off of assisted living? I don't know if we can or not, Kathy, but I'm happy to research that.
Lorraine?
Ursula? Ursula's behind you, Louise. Oh, back there.
Lorraine? Henry?
They have to come, since everybody's supposed to sign in, then there should be just entrance this way. And people who've been there before, they know they can ring the bell and then get buzzed in. So I don't think there's any need to put assisted living, since they're supposed to sign in.
Right, except for emergency services. It is important to have that signage there. So, but it's a good point, Ursula. Thank you. Yes, Vicky.
It would appear that all we really need to do is take the 7450 off of assisted living and just have it say assisted living. The number, you come down Pearl Street, that's when you see the number. And if it weren't on there, nobody needs it to be on there. That would be simple, I think.
Yeah, again, I'm happy to research us doing that. Michelle? So one of the questions is, can we change the numbers so they're not both the same? I don't know, but again, I'm happy to research. Michelle?
If I'm in North Wing and I request a lift ride, it comes out to assisted living door.
Yes. Okay. Again,
Even
duly
though
noted, I will research that.
Even though I put in 74,
report
it
back.
comes in out, whatever that is, Pacific Drive or something.
Right, right. Okay, all right. Any additional questions, Liz? Yes, everybody needs to come through the front desk to sign in. Okay, so again, her comment was that people need to come to the main entrance, they need to sign in, and that not for them to go to assisted living. So duly noted. Thank you, Liz. Yes.
Yes, this is Sid Jones. I'm in assisted living. We started the remodel in November and it's still not done. And here we're starting new projects all the time. For every workday, there've been at least 10 no work days.
Okay, thank you, Sid. So I'm sorry, Shelly? Oh, okay.
Well,
So Sid, all the projects have different vendors. I learned that you were kind of disappointed that we were working on the corner project while we were still working on the third floor of assisted living, but it's two separate vendors. We're not taking away your construction team and moving them to the corner. It's just two separate projects, two separate teams.
I realize that, but Lorraine is in charge of both of them.
She's got a big job, yes, but she manages them all. She manages them all from a higher level. She's not in the weeds with all of them. It's all the vendors, different vendors.
That's fine, but I can't believe how long it's taken. Get one job done before you start another one.
Well, thank you for the feedback, Sid. Thank you, I appreciate it. Okay, thank you, Lorraine.
Okay, you're welcome. All right, thank you, everyone. I think that's all the time.
Okay, sorry, we'll go quickly here. So big drum roll. I know you all saw the announcement, but to make it official, Mandel Gizzo is the Senior Director of Dining Services, and I really wish she was here. She was called away automatically to go up to Northern California for training. So she's in Northern California today and tomorrow for training, but I really wish she was here. I will tell you, I had a lot of people comment on Ann and promoting Ann for this position. I counted 75 resident endorsements. That was in the form of emails, handwritten notes, comments made while I was walking the campus. And then I had a lot of comments yesterday to my email, and those are some of the comments that came in. I think I had about 20 or 30 emails yesterday, just people expressing their joy that Ann was taking over this position. So on behalf of Ann, I want to thank you for all the support because she is very, very flattered and she's excited to take on this new role. So one other thing that I don't have on my slides that I was asked to speak about was the eco containers. Raise your hand if you attended the meeting at 2 o'clock regarding eco containers. Thank you everyone for participating. I'm told that it will be opening up to everyone else in the community. I don't have a date, but you're telling me they said the 10th. As soon as Monday. So they'll put up messaging about that. I wasn't in that meeting, but sounds like it's going very, very well. For those of you that were here a long time and had the system in the past, have an open mind. Let's try fresh and new and let's make it work. Okay. Next, I want to talk about the take it or leave it area. Raise your hand if you have a hand in this. Thank you. Thank you, Ken and Chuck and Mike and Bob, Ursula. There's so many good things that go on here. I don't know if you all realize everything that we collect. We collect clothing, batteries, corks, eyeglasses, e-waste, many, many, many things. And I think it's been a huge positive input to our community. So thank you for that. The one thing that I would ask though, sorry, is that, whoops. It's not forwarding. Is Louise still here? Is that we not clutter that space. There have been several items there that are large. It just looks cluttered. So I know we've had like a Chase lounge there. We've had beds and bed frames and mattresses and multiple bags of clothing. And I would just like to keep it looking neat and organized. So I'm asking for your help. What would you think if we did a team member sale once a month, where team members could come down and pay a nominal fee for items that you may not want? Many people have asked me if the staff can just take the items. They're not allowed to take items. So, so this is what I've just kind of come up with. If we could do a drop off the last Friday of every month, so beginning this month, for those large items that don't really fit in any of those containers you see on the screen, like televisions, air conditioning units, the Chase lounge that was there, bed frames, all of those larger items, if we could just plan, if you could hold on to them for that one day a month, bring them down between like 8 and noon, and then we would have an employee sale from noon to 4. Now, some of you may say, well, what if another resident wants those items? That's fine, just come between 8 and noon. Whatever is left over, we'll sell to the staff. We had a large sale when we were removing the furnishings from assisted living, and many of you may remember that. I don't think we charged more than $20 for anything that was in that sale. So, and the employees really, really appreciate that. Some of our sister communities have actual thrift stores that everyone can shop at. We aren't fortunate enough to have the space to have that, so this is our makeshift thrift store. So would anyone like to volunteer to help with this? Bob's waving his hand. Is that a question or are you volunteering? Question, okay. Okay, here comes the mic and Luis keeps running. He's gonna log his active everyday challenge hours for this meeting, certainly.
We're volunteering already.
You are, right.
Clothing. But I was
know.
wondering with this one-day sale, would that also include for team members clothes?
I would prefer it not include clothes because you can still drop off the clothing in the yellow buckets.
That's not for team members.
It's not for team members, no. Why do we have to charge the team members to buy anything? Because they're not allowed to take gifts. So we are able to sell for a very, very nominal fee. Like I say, I think we had beautiful furnishings from assisted living that cost at most $10. Most things were much less than that, but they're not allowed to take gifts and it can be seen as a gift. So we don't want to, it can be $1, it can be anything. Let's charge anything, just some sort of fee so that it's not considered a gift. Go ahead, Louise.
We have Goodwill pick it up at the end of the day.
We can, but I don't know about the end of the day, maybe in the next Monday or something like that. But yes, we will have Goodwill pick it up. So if we can all be on the same page and not take your large bulky items down there at any other time in the month, I would really appreciate it. Bring them down the last Friday of the month between 8 and noon. They'll go to the staff that want them or residents that want them, and then we can schedule a pickup shortly after. If we can all agree to that, I would really appreciate that. I don't like it
No way.
looking cluttered. Anita? What if a resident can't move the item themselves? Call Francisco, that's the answer. Schedule a time with Francisco and he'll help you move it. Luis? Oh, Mary?
Does this conflict in any way with the April pickup by the Goodwill truck?
Does this conflict in any way with the April pickup by the Goodwill truck? Well, I guess it could, but let's try to get as many items to the team members as possible so that Goodwill has fewer items to pick up. Again, the staff really enjoy these sales. There's always good quality items. I was kind of heartbroken when I learned of a perfectly good TV being sent to Goodwill recently, where certainly the team member could have, bought that for a nominal fee. Chuck?
Can we ask the resident to come and pick up their rug and bring it back in 3 weeks?
Yes, if you're the owner of the rug, please bring it back on March 28th. I know there's the rug there and there's something in a box. I think it might be a microwave. There's an air conditioning unit there as well. Yes, so whoever owns the rug and those couple of items, if you could bring it back the morning of March 28th, we'd appreciate it. Now back to my other question, any volunteers to help with this? The rug, oh, I just took the photo like an hour ago. The rug is gone already?
But some of you give away very unusual things. And I would appreciate you considering my delicate sensibilities and not giving away half-eaten food, used sex toys, yes. And I had to ask somebody. I had to say, what is this? But they knew, so okay. But anyway, use a little discretion. And the rug was gone 2 hours ago, but I guess maybe they didn't like it.
2 hours ago, okay.
Thank you.
Thank you to the rug owner that removed it. And Judy, for those of you on Zoom that didn't hear the first part, she maintains the take it or leave it cabinet. She appreciates items being left there that are respectful and courteous of her. That's what she meant to say. Yes. Okay, well, if there's any volunteers, feel free to email me afterwards or stop and see me after this meeting. That's all we have for today, unless there's any other questions. Ursula.
Talking about Anne, what will be her job description? Because it's different from what she's doing now, right?
Right.
Will she still be on the floor, or is she going to be where Vivian was disappearing somewhere in the office?
So what will be Anne's job description? So Anne will be in charge of all of dining. So she'll oversee the main dining room, the back of the house, the kitchen area. She'll oversee the healthcare side of food service as well, the entire dining operation. So no, she might not be in the dining room every day like she is currently, because she has a broader scope.
So then who would be taking her position?
We will publicize that. We will put that position in ASAP to open that up.
I vote for Esau.
I just like to say that I had put together a resident panel to interview Anne. And we were 100% behind her, but one of the questions we said was, you aren't going to disappear, are you? Because she makes such a change when she's in the dining room. And she said, no, don't worry, you're going to see a lot of me. So.
Okay, any other questions before we close the meeting, Larry?
The staff problems in the dining room. It
What are
seems that we hear a lot of times that we don't have enough staff to do this. Are there, how many vacancies are there and who does that hiring?
What are the staff problems in the dining room? It seems we hear that there are staff shortages.
In the front of the dining room, not as waiters and waitresses.
Right, front of the house, as of Wednesday, had 3 open positions. I think they're all part-time. It's mostly the 4 to 8 position. It's students that come here after school. That seems to have the most turnover. Back of the house is full, and I know Jody in healthcare had 1 opening.
And who does that hiring?
The hiring for the front of the house is currently Anne.
Okay.
Dave hires for the back of the house and Jody hires for the higher levels of care.
Right. Okay, thank you.
All right, everyone. Have a great afternoon. Thank you for coming.